Welcome to our newsletter. It's interesting to reflect on how the BRC has evolved over 10 years. In the last cycle of the BRC, our focus was really shifting the activity that we supported towards early phase trials, pulling through discovery science from UCL, working in partnership with SMEs in the UK to deliver that science into innovative medicines and innovative diagnostics in clinical practice at UCLH. In the last year or so, we've seen major launches of companies spun out from the partnership of UCL with UCLH, a lot of that underpinned by the translational infrastructure supported by the BRC. And what we want to see is more of that. And in this cycle of the BRC, our focus is really on translational research. If we look at our feedback this year from our annual report from NIHR, we can see that the UCLH BRC and its partnership with UCL is number one in many, if not most, of the key metrics, and it really reflects the tremendous work being done by all of those who are supported by the BRC. Now, in the next year or so, it's going to be a critical period because we need to see that translation evolve even more. And I was very excited that the Trust Board at UCLH endorsed the concept that the hospital is now a research hospital. And what that means is that we will continue, of course, to invest in our translational research in early phase trials and also try and grow our later phase trial program. But the new part of the innovation is to build programs and infrastructure that allow us to access the data that we collect routinely in the NHS to do a number of things. Firstly, improve our operational performance and learn more about how we might do that with more sophisticated analysis of that data, and also develop decision support systems and bring in the expertise in artificial intelligence, machine learning, and really grow that space. So it's an exciting time. We need to keep the drive going in terms of translation so that we can continue to ride high in terms of our performance as a biomedical research centre. So I hope you like the format of the new newsletter. What we've actually done is decided to use more spoken word, if you like, as part of the introduction to the newsletter, and each time that will evolve because we'll be talking about more specific topics. Today was more of a general introduction to the new newsletter, and we'll be getting some of our investigators to talk to camera about the research that they're doing. And I think this new format is probably more consistent and accessible with the way media is being communicated today.